know more about us, but really what's important is we learn more about what's going on with the COVID-19 and the state of Montana. So Jackie, what are we covering today?
Today we're going to talk about the most recent legislation. To get there, we'll do a quick overview of all of the bills that have been passed. We'll talk about the president's reopening plan, go into Montana's reopening plan, and then really get into what this looks like for your law firm and for the employers that you advise. We didn't go deeply into a lot of the court guidance, things like that. If you have those questions, we did receive an email question earlier today. Feel free to put those in the chat and we can continue to have that discussion. But since the primary event that has happened since the last CLE that we did is this reopening and phased reopening, we thought we would focus on that. But again, any questions, feel free to ask those.
Thanks, Jackie. So yeah. I guess really what we wanted to do is update you from the last time we spoke about the fact that not only do we have the FFCRA and the CARES Act, but we have an add-on that was passed on April 24th to essentially the CARES Act, which wraps around in bringing some additional funding for stimulus to a lot of different places. And I think we're just going to dive in there. Starting on a federal.
I know that Erin.
Go ahead, Jackie.
I know you were getting sick of this slide, so I thought I would take this one for you.
Sounds good.
Since I know you've discussed this over and over. The first thing that really came into play was the emergency paid sick leave in the Family First Coronavirus Response Act. We often shorten it to FFCRA. And making sure that by April 1st, your employers have put that into place. So making sure that you're offering paid sick leave, regular rate of pay when they're unable to work because the employee themselves is quarantined or experiencing symptoms. Then depending on the size of your employer, you may also have to offer 2 weeks at the 2/3 pay if they're needing to care for someone or if they do not have child care. There is a small business exception to that second amount of paid sick leave. And then there is also the additional 10 weeks of expanded family and medical leave when there is also a need for care or sickness. So just go ahead and make sure that your firm, all of your clients have had this in place now for a month, realizing that any time given previous to April 1st does not count as part of this. So this is a separate program.
And Jackie, I'd like to note too, if you don't mind, on that slide, a couple of things. First is to remember that there are some exemptions to the emergency family and medical leave expansion piece, depending on what type of employees are asking for this potential leave. If the employees are needed, such as in a healthcare facility or for treating people, they may be exempted from this benefit, and the employer can look at that and decide. So if you advise healthcare entities, you're going to want to look at that. Also, to remind your clients to really keep track of the emergency paid sick leave that they're giving, because they can get tax credits for that. And so they should be tracking that. A lot of the payroll organizations that provide services to our clients, they're actually setting aside separate accounting pieces in their software for employers to actually note those details so they can come back around and utilize that information for taxes. So I think it's just important that people understand they really should be tracking all of these details separately from their regular sick and vacation time that their employees might otherwise take, because they can later get credit for those things. And, you know, I think that remembering that will help us and our clients get to where we need to go eventually with all of this.
Right. And just so everyone knows, in the downloadable version of this, of the materials, all of the links to any of this are included. So anything that's underlined will have a link to where you can find more information on that.
Thanks, Jackie.
We did include some state-specific information. The Montana Department of Labor and Industry has a lot of great resources. This is for both employers and employees on their website. This is a handy one-pager that they put together on what may apply, whether it be the paid sick leave, unemployment. There's been a number of changes in unemployment as far as who qualifies, the amount they receive. A business will not have that taken from them. It's a separate employment insurance system now. And then if it is a healthcare worker who is sick, that maybe work comp could come into play. Also, just wanting to remind everyone that for employers, be sure that they're sending out the notice if they are laying off employees due to COVID, or really for anything, but especially now during the COVID, making sure that they're getting this notice on how to file for unemployment. So just keeping that as part of the process if layoff ultimately is what happens.
And that link for COVID resources, that's a really great link. There's lots of FAQ there, and it's a great place to go. And I would say start there if you have questions, and hopefully all of them will be answered. Also, make sure that everybody does know that self-employed individuals can obtain unemployment. They can apply through the system, and depending on their situation, likely can be granted unemployment insurance benefits if they are unable to provide services through the business they were running through self-employment. So that's key too for a lot of people. And you know, hopefully we can grab some of those clients that we help that don't know these things, and you know, get this information to them too.
So one question that we had over when getting ready for this is to touch on salary and exempt employees. And again, there's a really great FAQ on the Federal Department of Labor site talking about Fair Labor Standards Act and COVID-19, just reminding that for the most part, exempt salary employees must receive their full salary in any week which they perform any work. You can require them to take vacation time so long as they're paid. I think the biggest message for employees and employers is trying to be flexible during this time, trying to make alternative work sites happen and be available. I know that most schools right now in the state have chosen to not return kids back to school for the remainder of the year. I think Helena is one of the only, or no, Helena did decide last night. It was East Helena, I think, who's still on the fence. And I know there's a couple of places around the state still on the fence about what to do, but that may really be a reason, childcare, that workers or employers are going to have to be a little bit more flexible. And then making sure that if telework is provided due to a disability, the employer must be paid at the same rate. Otherwise, the standard really is you have to pay minimum wage for hours worked, and full salary if the salary employee does any work in that week. And then also the question sometimes comes up as to, well, can I require my employee to have to get internet or other things in order to be able to telework? So long as that burden of what they need to spend their money on to do telework does not cause their wages to go below the minimum wage or what they should be getting on overtime, you can, but once you hit that point, you may be on the hook to pay for internet. So if you're requiring telework of minimum wage employees, chances are you're going to have to pay for anything that they need.
Thanks, Jackie. And, you know, this goes back a little bit to what we talked about in our previous breakfast briefings, which is making sure that we know the security of our employees. And I know for law firms, we have a much higher standard than some employers, but, you know, it probably behooves a lot of employers to make sure that they're providing, you know, the technology that people need, the security that people need, so that business information isn't just lying out there on personal computers and other things. So those are things that we should keep talking about and making sure that people have resources to be secure, to interact. We've talked about using Slack and other platforms to send instant messaging instead of texting, and also using, you know, file sharing platforms like we do, the share file, that really make work easier for your employees. If you have any questions about some of the options out there, let us know. We even have some slide decks that we could provide to you about that. But whether it's you or your client, there are a lot of options out there to make life easier to do telework and not make it feel so overwhelming, maybe in circumstances where people don't have the platforms they need to interact.
I just want to respond to a question. There is, I think, a lot of folks who were anticipating getting unemployment and have heard about the changes in real time as they're happening at the federal level or state level, and their expectation is they'll be receiving money quickly. I know for a lot of self-employed independent contractors, those folks are in this new eligibility. Payment is coming. It just has taken a little bit longer than was initially anticipated. So they should be getting the money, and it is retroactive, and it will come in large chunks of payment, but maybe not. I think some people are expecting that they'd be able to calculate it easily, like, oh, this is 2 weeks or something. I've heard that payments can come in a little bit of random distributions. And I'll kind of lead that into this next part where we talk about the CARES Act, the Coronavirus Aid, Relief, and Economic Security Act. The first part of that is the expanded UI, which increases the benefits to $600 per week up to 4 months. I know that some people are starting to get that now. It's coming in $1,200, $1,800 payments. So those will be happening, but I think that telling folks to be patient is probably the best thing to do, so long as they've received word from the Department of Labor that they have been accepted. They should be just fine. I would also say that Department of Labor is absolutely swamped with processing the number of claims. I know that at 1 week where they would typically have a few hundred, they had over 30,000. They've had a few days where their website has crashed. So I know it's not an easy thing to say to someone waiting for money, but patience, I think, is a little bit key here.
And we have heard that things are getting pushed through. People are starting to get their money, and that includes self-employed individuals who they didn't even have a place for them to really figure out how to get into the system initially. And Montana's actually done a really good job of getting those things accomplished. So we're relatively lucky here in getting that done, even though there may be some delay. And then Jackie, do you mind if I take on some of these topics of the paycheck or the PPP, our paycheck protection program? So
yeah, we're going to go into that pretty in depth. I do want to stop just for a minute on the $1,200 because we have had a question about folks not receiving it. The IRS has a number of tools. One is that you can put in your direct deposit information if you have not filed taxes or if you have not had a need to give the government your bank account information in the last 2 years. Some people are either paying or they've, they're $0 being transacted, those sorts of things. So I would encourage you to, there's also a track my stimulus payment. They are saying that if the federal government did not have your bank account information before these first rounds of checks went out, it's probably going to be the fall before the paper checks arrive for most people. So it may be a little early to say I didn't get mine. I think that tracker is probably your best bet to understand if you are getting it or not. And do you want me to go forward, Erin, on the more in-depth of the paycheck?
Sure, Jackie, that's great. We also have a couple questions that have popped up, one about that. But yeah, let's do that. We can dive in. And you can take a look at those questions while I take a look at this slide. So this is our most recent act that was passed on the 24th, I believe, of April. And they're calling it the Paycheck Protection Program and Healthcare Enhancement Act, referring to it as phase 3.5 of Congress's stimulus. The president signed it into law, and I don't know if you have any clients or you experience that applying for the PPP program, what proved to be difficult for some people who didn't get in right away because the funds just got depleted by large organizations that really sucked it up within a matter of hours. And so what we do know, because we have some clients who started getting the new PPP monies, is that did start being distributed this week. So by Monday, they were getting those loans not only approved, but also pushed through. So the additional $310 billion is going out to employers. What I would say, though, is that people should still be diligent in getting these loans to the extent they need them. And to remember that you really need to utilize, and we'll go into this in another slide, but you need to utilize it for paychecks and payroll, and that's really key. It's also, I think, an important detail to note that this stimulus package wasn't just PPP money. It also sent money to lenders, also for disaster loans and grants. So those things might apply to some of your clients. So you might want to look into that. Also, hospitals are getting additional money and other healthcare entities. And we also got some money for testing. So there are a number of things that came out of this new stimulus that are going into areas that were missed by the previous stimulus. And it sounds like they're working on another stimulus package that would go to capital investment and industrial development. So I guess we'll see, and we'll come back around and talk to you about that when it happens. But there's a lot more to this than just PPP, but I do think we want to dive into that a little bit on the next slide, right, Jackie?
Sorry, Erin, I want to go back and just quickly touch on the $1,200 payments. There was a few more questions. Okay. I did in the chat box put the link for, they're called economic impact payments. I put the link to the IRS page on those where you can both enter in your bank account information if they don't already have it, and also to track. So that is on the chat function right now if you want to check that out. The other question was college students, and there is a group of college students who will not get, and they're not necessarily college, but college age students who will not get the stimulus payment because their parent won't get that, or whoever's claiming them as a dependent. So if they're in that group and they're claimed as a dependent, excuse me, then they won't be getting it because they're a dependent. And when you're over 18, your parent will not get the child money on theirs. So there's a group of people, typically those who are still on their parents' health insurance, so they remain a dependent for that purposes, or they're in college and they really are a dependent. And so that group will not be getting stimulus payments, nor will their parent be getting anything. The other was farmers, and there are some other programs going on to assist farmers with family farms that generate income from that family farm. So they will likely have other resources available to them outside of paycheck protection and outside of the stimulus that can get, and I will answer any questions and find some links on more information like that. But those two groups likely will not. Social Security beneficiaries will get the stimulus payment. I know that was a question both for disability and then those over who have Social Security due to age. So both of those groups will have the full, and if they're on SSI, they'll get the child portion as well. So now we can go into more on the paycheck protection.
Thanks, Jackie. And we did tell Sam we'd be answering questions as we went. We think it's easier that way. So this may push us over a little bit, but hopefully we're getting all of your questions answered. We did have a question regarding repayment. Yes, so the main points are that not more than 25% of that PPP money can be spent on things other than not payroll. So make sure that you and people know that and you're tracking it. A lot of people are opening separate bank accounts for this money to go into, paying payroll directly out of it, and just making sure that it's not commingled and you can tell that it was all payroll costs that came out to the extent that that's happening. Also, a question was asked regarding having to spend it within 8 weeks. And the answer is yes, they're expecting you to spend it now within 8 weeks on payroll. And that should be able to be done because the way that they base the loan payment is if you keep everybody fully employed, you should be able to do that. And then you're going to need to go back around and show the bank that you've done that. So keeping the records, and then towards the end of the 8 weeks, sending that information to the bank to ensure that you've shown that documentation before the end of that 8 weeks is going to be key also. So really making sure that you and your clients docket that information and meet the deadlines, because if you're not verifying that you've met the requirements within that 8 week period, the loan gets converted, or sorry, the loan stays a loan, does not get converted into a grant, and will need to be repaid. Although there is a delay in payment, it still has to be repaid, and there will be some interest, not a great amount of interest, but interest that will be owed to. So don't want that to happen, and this is one place you really want to be diligent. And
Erin, I think somehow I skipped ahead 2 slides, and so we should have a slide before this. There we go. Sorry about that. So this one, just so you know, there's a link through the SBA that gives great information, and then that we'll go back to that next slide. That there's also great information on the Treasury, but we kind of jumped ahead. Sorry about that. So I don't know if you want to do a quick overview of the paycheck protection. It sounds like most people understand what it is, but
right. So yeah, this accurate calculation of payroll is important. Really keeping good records. And you know, take a look at what people are making in excess of $100,000 annually on payroll. That's going to be important. The 8-week period does begin the date the lender makes the first disbursement. So that happens, that clock starts immediately. And then, you know, just go into the SBA information if you're doing anything around these loans and make sure you know it. That's really, we can't go over everything on the slides, and there's just so much there. And then, yes, that next slide, Jackie, that IRS information is really important. So if you go into the Treasury, so I shouldn't say IRS, I apologize, the Treasury information, the Treasury website, again, a great place that has even more and better information about compliance than the SBA site. So those two sites together, those two links on these two slides, are going to be your key to going in and getting at least the basic information for these programs.
So a couple clarifications that I think may help. If you look down, it says rehiring, you have until June 30th. That's when they say that the Paycheck Protection Program ends, is June 30th. But what we saw during the first round of loans, the money became available on April 10th and it was exhausted by April 16th. I think we're going to have a similar experience now, where the money goes very quickly. So that June 30th date is a little bit misleading. You have until, you know, you get the money and get back up to speed. One of the questions that was asked is, what if you get to the end of the 8 weeks and you still don't have enough work and you've taken the loan and then you lay off staff again? Is the loan still forgiven? And Erin, I believe that so long as you use the money during the 8 weeks under the guidelines, what you do, there's no recommendations beyond that 8 weeks as to what you'll do. This was to get you through the 8 weeks. Is that your understanding? I can certainly do a little bit more work on that.
It is to get you through the 8 weeks, and you do have to make attestations regarding the amount of people you're going to keep employed. So I would say what people need to do is make sure that they are compliant with the attestations that have to be made. So those documents and the applications, they're pretty clear as to what you're attesting to, and you know, the guidance is always going to be stay within that, because you're going to be held to what you sign.
And we'll probably have to pick this up a little bit. I know there's a lot of questions on these loans, and I really do encourage you, but we'll try to do our best. If you have an employee that's over the $100,000, Erin, can you talk about that? What can you do with the loan money in regards to that person? And when do you need to provide the proof? Could we just go over that again?
Right, and the banks are still getting guidance on some of those details as far as the proof and how that's going to be done. So I would go back to your bank, figure out how they want you to do it and what form. And again, be looking at that 8-week deadline and work coordinating with your bank. As to the person who makes more than $100,000, I don't know the full answer to that question. I hate to give legal advice on this call, and so I think the best case scenario is to review the particular person's scenario under the guidelines that we've provided. And then if you're having a hard time sorting it out, of course, we'll be willing to talk it out with you. Yeah, I just don't feel like we're in a good place to provide such limited advice in particular scenarios on this call, Jackie.
Great. So this is going to be a reality both in firms and in our clients, is that just yesterday, the Bureau of Business and Economic Research at UM did say that they're anticipating 50,000 jobs lost this year. So there will be a big impact. I think helping to get clients through this next 8 weeks is important. the sooner the better. There's no delay on applying for these loans. You can get one through any local lender. You can get one through the SBA, but if the last round of loan payments tells us anything, it's that the money goes very quickly.
Yeah, and the reports coming out today on growth, you know, we're at the end of the quarter. They're showing that even though we were increasing in growth coming into the first couple of months, the decrease in growth just over the last couple of weeks has taken us into a negative direction. And that over this next quarter, which we'll have to evaluate in July, we're going to see across the country a 30% slowdown, which is the quickest and worst slowdown we've seen since the Depression in the 1930s. And so we just need to be aware of that. And we do need to make sure that we anticipate taking advantage of what's being provided to us to keep our economy and our businesses going. And I think that the rest of the program that we're going to give will sort of help us contemplate how we can do that, Jackie. And hopefully, you know, we can make it so that that estimate isn't as bad as it seems or that it might be.
And just a final comment on the loans, that sole proprietors are eligible. So I did just put in the chat the eligibility guidelines. We just want to provide a one-stop shop as far as where to find reliable resources on COVID-19 and especially guidance for businesses. So World Health Organization, the Federal Health and Human Services, the Centers for Medicare and Medicaid, OSHA, CDC, state and local, the governor's coronavirus task force website is still really up to date. Our Department of Health website is great. And then Department of Labor, like Erin had mentioned, is putting out some really nice FAQs that I think talk about scenarios from the perspective of being in Montana and some real life issues that we're going through. One final on the $1,200 payment too. After a certain date, I know that if you had tax liability, they could not retrieve that check. It's also protected from creditors, but some people were in the very initial stages of getting their stimulus and it was taken for those purposes. Is my understanding, and I don't know on this, is that you can't really go back, but that shouldn't be happening with any payments going out now. But you'll want to look into the specific circumstances, but that is in the law that it was supposed to go out whether you had previously owed tax liability or not.
And Jackie, there was a question regarding the fact that there are additional loans outside of the PPP loans. And yes, there are different types of loans for different types of employers and businesses experiencing different types of cost issues. So you definitely should check with your bank, because the SBA is not only giving out the PPP loans, but other loans that help cover certain costs related to the pandemic. And there are also on the back end program implementations that will give tax credits and also some other tax forgiveness on costs related to COVID. So a key piece of this is knowing what your sector is, coordinating with your bank, and also making sure that you track your costs to the extent possible, and potentially also losses that you expected to have in relation to the pandemic. So it's just a lot of that bookkeeping. And then as we move forward in this and get more guidance, we'll be able to know what to do with obtaining more funding and also with getting those tax credits.
Great. So we just wanted to give a little overview of kind of how quickly we've been in events have happened. You know, the state of emergency was declared in Montana on March 12th. It's now only April 29th, and there's been a lot of movement. I don't know, Erin, if there was any of this you really wanted to
no, I think it's important. It's just important for all of us to just remember how quickly this has gone from for presumptive positive cases to 451 cases and 15 deaths. So very quickly. And as we're opening things up and talking about opening things up and getting the economy going, it's also really important to remember how quickly we can go from 4 to 451 cases. And of course, those are the only people tested. And there are a lot of people who went in to try to get tested, but they weren't showing what appeared to be sort of like the key identifiers of the illness. So we know we missed a lot of individuals who didn't get seriously enough ill to get hospitalized or meet the criteria for testing, because we've had some testing shortages. And so we know we've even had more cases than that. So I think it's just really important to know that this can go from a little bit of cases to a lot of cases very quickly. We've done a great job in our state. We're one of the lowest in the world, really, as far as multiplication factors, but we still have done some serious multiplication, and that could happen again.
So when thinking about number of cases, I think it's important to remember just what Erin said. We don't know the exact data. We know who's of the people who've been tested and reported, we have that information. So the slide on the top left, this is all available at the Montana Department of Public Health and Human Services. And this shows total confirmed cases since the beginning to now. Though this map on the right-hand side is a fairly new feature of the DPHHO website, where they are now tracking the active cases of people who have not recovered from the virus, the disease yet. So, but again, these are all solely based on of those who are tested. So while it may say that Lewis and Clark County only has 3 cases, that's only as true as the folks who are tested, and not necessarily an accurate count.
Right. And we'll be somewhat delayed by a couple of weeks as we see how this opening up affects us. And we just need to remember that and know that the person across from you, still, you can't tell whether or not they've got it. And so here we have our opening up of America again notice from the federal government that really prompted states to start looking at how we might be able to open up the economy, open up businesses, while still trying to keep people safe. And so they've come up with this phased approach, 3 phases. We're in phase 1 right now, as far as our state is concerned. And our state also has developed its own guidelines within the phase. We don't know when we'll go to phase 2. There is no time frame on it. And phase 3, we're thinking, and everybody else is thinking, likely will be pretty far out, depending on how phase 1 and phase 2 go over the course. So we didn't do much with phase 3 today. We are going to talk about phase 1 and phase 2. If you want to talk more about it, we can talk more about it later. And then we can head directly into Montana's phasing, because we entered into a phased approach almost immediately after the president put out the phasing notice of trying to open things back up. So you can see that we have this immediate press release from DPHHS on Wednesday, April 22nd, 2020, and also had the Reopening the Big Sky document that was put out by the governor's office. And really the key here is the positive number of cases were declining. And because we were having those decline, then the state decided that we could try to open up and see where it went from there. Oh. Jackie, this is your slide, so I'm going to let you take this.
I just thought this was hilarious. If you have social media, you've seen this over the last couple of days. I don't think that people always know where Montana is. So unfortunately, some folks think that we're Missouri, but we are actually opening up. Missouri is not. So I just thought we needed a little humor. And in case you're not a social media fan, you're missing out. To get more serious again, we are going to go pretty in depth into phase one and hopefully give you some really good information. So I know, Erin, that this is really the key points, though, that you want to drive home right now on phase one.
Right. Phase one doesn't mean go out and act like everything is normal. Phase one means keep everyone teleworking to the extent possible. Go out and do what you need to do, but in a mask to the extent possible to keep yourself and others safe. Make sure that you can work alternative work schedules to the extent people need to go in, if at all possible. Shift working, keeping areas clean. We have lots of guidance here on how employers can keep things clean and disinfected, do shift staggering, closing common areas. We did notice, I didn't, but there were employees of ours who did have to go out this week and notice that there was some serious crowding in some areas, that people were trying to get in and get services that they hadn't received in a while. And people were not standing apart. They weren't wearing masks, and they were waiting in waiting rooms very close together for long periods of time. That's not going to bode well if one of those people in that group is infected and people don't know and could infect, a large group of people in a small amount of time. So we need to remember that we are not back to normal, and that special accommodations should be made for anybody who's in the vulnerable population as far as employees are concerned, and even individuals that are coming into businesses, but also individuals who have in their household people who are vulnerable. Need to remember that if they go out and get infected and bring that home, then keeping the vulnerable person home is pointless and useless. So if you need a resource for masks, or an employer needs a resource for masks, please let us know. We might be able to help coordinate that. We are providing, masks to our employees, cloth masks that they can wash and reuse, and to those individuals around us who could potentially infect us or our employees. So that's something you could also think about, just making sure that the people around you and that are in your employ are protected and given what they need in order to stay safe.
So we did put the details of phase one, and this is all available on the governor's website. It's available many places, all the news sites, any of your local health departments. But restaurants, bars, breweries, that was a big one. They're still on hold until May 4th. And we'll go into the recommendations for those places. Senior living, assisted living, still prohibiting visitors. And then retail businesses in some locations are now open, not all. So one of the things that this phased approach really did is took things out of the governor's hands and put it back on the locals. So it is very important to be looking at information specific to your county and not just relying on this opening plan by the governor.
Right, and we're going to go into that, Jackie, what some of the counties are doing and what that looks like and where you can find your county's information. One of the questions that we had is, where are we getting the masks we're giving to employees? We have a couple of people who were at home and were good seamstresses that we had contact with, and they offered to make masks. And so not only did we help obtain masks for some healthcare providers through the process of volunteers making masks, but we were able to obtain some for our firm and people associated with the firm. And really, when it comes down to it, I think across the country, that's where a lot of people are getting their masks right now, especially those that aren't on PPE lists for the, for the healthcare provider realm. But even those healthcare providers that are getting PPE, there are certain circumstances where they're sending employees home with cloth masks in order to try to help the employees stay safe at home and in the public. So to the extent that you know a seamstress, there are really good patterns out there. One of the patterns that we know has been the best includes like a metal piece that comes across the nose. And I know, Jackie, you have a little bit more information on that, but there are probably some masks that are better than others, but you know, we're just doing the best we can to get them from where we can get them.
If anyone is interested in a mask pattern that allows for the metal piece around the nose, ties, and a place to slide a filter in, and the best material for the filter, my mom has made a couple of 100 masks that are in this style. They're in high demand. So if you have an interest in that, certainly reach out to me and I can get you in touch with my mom, who is now basically a mask factory.
There's also somebody posted a link to somebody else who's making a mask, probably for sale. So that's in the Q&A.
Right. Well, childcare facilities are operational. Youth activities. We really encourage you, if your local health department is hosting any sort of weekly calls, to engage in those. You can get a lot of answers directly from your local public health official and their interpretation of this. I know Lewis and Clark County does one on Fridays. I've looked around, a lot of different counties are hosting these, so it is really nice. Also, your public health departments are so responsive to any questions. So that's another resource, because again, this guidance to the state may be interpreted differently in your county, but organized youth activities can become operational, but you really have to keep the group small and the physical distance. So, you know, maybe some practice, but probably not a soccer game. No gyms, outdoor recreational is okay, as long as the physical distancing. Places of worship were one of the first places to open, but again, limited capacity and physical distancing between non-household members. That non-household members is applicable to all of this. You can get close to folks who you live with, but anyone else, you have to keep that social distancing. But other places of assembly, we did remove the bingo hall, but the bingo halls are included. And so, you know, any of those sorts of places are closed in phase 1. So Erin, was there anything else? And I can go into the counties.
Well, we had one question about employees who don't feel safe. We did provide OSHA links on here. So I think it's important, before you get into, is unemployment available for employees who don't feel safe, we need to look at, okay, what is being done to ensure that, to the extent an employee has to go into work, that workplace is, you know, being sanitized and all of the precautions are being taken. And then once you go to that space, if the employee is still not feeling safe, that's not a reason necessarily that they could obtain an unemployment. I don't know what an unemployment is doing for those individuals. It's my understanding that if they don't give a reason for layoff beyond "I didn't feel safe," they may not get it. So that does need to be a consideration they're taking. I think there needs to be a lot of dialogue, like you said, between the employer and the employee to ensure that the person has what they need in order to feel safe at work.
Great. So I spent some time, I've been on phone calls with different counties and looking at county websites. You can just type in Montana County Public Health Departments and you can get the full list that's compiled at DPHHS, or just go to your local. You do sometimes have a number of clicks. You got to click around and find the COVID-19 resources and just be patient and click around their sites. These links on the counties that I've put up have the direct link to the COVID-19 information for businesses. So we were just putting on what is available for food service guidance in the different counties. So if you start with Lewis and Clark, Realize that the statewide ban on restaurants for eat-in, obviously the carry-out and the drive-through is available now, but for eat-in goes to May 4th. So some websites make that really clear, the May 4th. Other ones you would have to know that the May 4th is in effect through the governor's order. So Lewis and Clark County, what they're saying is they're really hoping that businesses develop a written plan. If they get a complaint from someone in the community that the business is not operating in line with what's required, the health department will go out, ask to see the plan. If they don't have a plan written, they will ask the business to develop one as step one of the correction active order. And just know that different counties are then using the ability to fine businesses in different ways. I know in Lewis and Clark County, it would probably take at least 3 different times of the public health department and the sheriff going out before a business is fined. That may be different in different places. Missoula County didn't make the May 4th explicit. They may actually wait a little more. And they too are just recommending that businesses develop a plan, implement that plan. And then my understanding from Missoula County is they'll be doing random inspections of businesses after they're allowed to open. Now, here's a difference in something that you'll see. Yellowstone County, the establishments have to produce and have a plan approved before they open. So all of those materials for the plan are available on the Yellowstone County website. They have to submit that to their health officer. The health officer will have to approve it, notify the business that the plan has been approved. Currently, they have not given guidance as to when everything will be open in Yellowstone County for restaurants. So they're just saying for now, get your plans in and stay tuned.
And Jackie, this is really where we got the title of the program. What we need to remember as we're advising clients, to the extent we do it across the state, is that each place is different. Some may be roaring ahead, others may be doing it much more slowly, and some may not be opening up at all right now, at least in the short run for some businesses. So it's really important, like you're talking about, to go local and really figure out what your local county is doing. This slide that you're heading into now, Jackie, this is not only a great example that people can use even from other counties of some attestations that are being made, but also of the difference between counties on what they're doing. And I know, Jackie, you've been following the Butte Silver Bow process very closely because it seems to be very detailed and pretty well laid out for the businesses and hands-on.
Right. I've been really impressed by Butte Silver Bow. If you go to their website, you can listen to the recorded call that they did last week about this. I found it to be very soothing, maybe because I'm from Butte. Butte voices are just very soothing to me, but Butte accents. But written business plans have to get into the health department by May 8th. That again is required. And then they will go out and do an inspection after the individualized plan has been received. They may allow the business to open without the inspection, just depending on time, but both the inspection and the plan are required in Butte Silver Bow. And then they put and they're not the only county. Other counties have examples, and other counties that require also have forms. But I found that they had really great examples of how to write a plan. They're also encouraging their employers to post their plans on their websites, on social media, so consumers can check it out before they go. And I thought that was a great idea, and also just a good advertising tool for a business. But seeing a lot of good things out of there. Finally, Flathead County does not require a plan, does not require an inspection, does not require approval. They do have a lot of resources on ideas that businesses can implement to reduce the spread. And there is a violation complaint form if someone wants to report a business, but there's nothing, it's all kind of after the opening and not before. Central Montana Health Department, based out of Lewistown, they cover a few of their regional health office. Before reopening, they have to sign and return a reopening plan agreement to the county sanitarian, and that's for food service and all other businesses. Some of these are food service specific, some are all business, so you'll want to go to that local county and find out. And these are for businesses that were not deemed essential, right, before phase one. So if you are a phase one business and you've been open this whole time, this wouldn't apply to you. This is for businesses who were non-essential and now are reopening under phase one. And then finally, Gallatin County, there is a checklist. I really like the Gallatin County forms and things. Are really fun, really well done. But the checklist is optional, whether you return that to the health department or not. That would have employee health agreements, which I think are a great idea, your plans for cleaning, your plan for social distancing, a training log for your employee, and then all the signs for your facility. So they fleshed theirs out pretty well too. I think the employee health agreements and the reminder on training is a great one.
Yeah, those forms there, Jackie, really are good. Yeah, those forms that are at Gallatin County, if you're looking for something to be comprehensive with, or you're looking at something that you want to talk through with a client about options, that really is a good place to go, even if you're not in Gallatin County, if your county doesn't give you as much guidance, because the employee agreements, I think, are really helpful in, doing your best to protect yourself from liability as a business owner, making sure the employees know what their job is, doing training with them and showing that they have been trained on the disinfecting and the OSHA requirements and all of those things. So it is really a great place to go. And the signs that you can put up that they've developed there are great too. And we're just, I think, lucky that we have, yeah, there you go. There's some of the signs and information that we wanted to show you, but we're very lucky because we have great health department representatives and leaders around the state who are doing a great job to give us all information that we can use as we move forward, and our clients, we don't have to reinvent the wheel because it's right here for us.
So I know that we wanted to provide, Erin, just some guidance generally from the CDC. This link to the CDC is very, very comprehensive site on recommendations. We pulled out a few of them, pretty much in line with what our locals are doing, but definitely encourage you to check out this website. And also OSHA has put out guidance specific to certain industries. So I know construction industry gets a lot of questions, as well as food service. So you can look at the OSHA CDC guidance on that.
We could do an hour presentation just on one of these links here. So by no means have we covered it, and you should definitely jump into both of those links to figure out where most of your employers sit, what they could be doing, and putting together in your mind the best guidance for you, your law firms, and the people that you serve. It's just, the amount of information is immense on what we can be doing depending on the sector. And I know, Jackie, we did get a question related to testing. We put on a 1.5-hour CLE yesterday and talked a little bit more about this than we had planned on doing today. Today, we were just really going to talk about the fact that in order for us to move to phase 2, we really are going to have a lot more testing. And that means testing everyone, not only testing them to see whether or not they have the virus, but also testing them to see that whether they have the antibodies and have already had the virus. And so the issue really has been with regard to testing is, even though we are opening a lot of testing sites, we don't have the testing reagents and supplies that we need to get everyone tested across the country. that is happening more and more. More companies are opening up their manufacturing areas to create these tests. The tests are becoming better. We've had a lot of tests that came out that really didn't give us enough information because they weren't reliable. And so, you know, as the weeks go on, I know that will change. But really, in order to move into the next phases, we're going to need to know how phase one is working. And we won't know how phase one is working until we start getting people more comprehensively tested. And that just sort of is what it is. We gave you a little bit of information here, plus some interesting photos, and can go into more depth with you on where the testing is for our counties, for our healthcare providers, and what that looks like. There's different types of tests coming out. Before, people were avoiding the test, I think, and if they didn't really have to get one, because the main test that's out there is they have to stick the swab about 4 inches up your nose. It has to come back around and touch your throat where your nose meets. And people that, you know, it's not a feel good test. They're moving into some testing capacity where you can swab your own nose and spit into a cup and put those two things together. That's one example of a test where a person can do a self-test in front of a healthcare provider. And then those self-tests don't require the healthcare providers to change and don different PPE for each person. So we're moving into a different phase. I don't know how quickly we'll get to do that here in Montana. I do know that although we do have increased testing sites, we are having difficulty getting the supplies and the reagents, and that will just maybe keep happening for a little bit. You know, we can always do a more in-depth program on that later once we know more, but that's really where we are right now. And so this phase one may last longer simply because we don't have the supplies we need to evaluate where we are in it. And I think we need to be prepared for that.
Right, and just because it is 10:04, I know Sam let us know that you can get an additional 0.5 CLE credit if you remain on until we're finished. We're hoping we'll still wrap up here soon, but in case people are getting nervous, if you do have to go, please feel free to reach out to us with any additional questions. When it comes to contact tracing, there was a report out yesterday that we are now conducting contact tracing through Montana DPHHS. There are both public health nurses, other nurses who have been contracted to work to do this, which would mean, and this is a manual contact tracing, right? So finding out people who are testing positive and then reaching out to all of their contacts. So we have found, compared to other countries that are doing more electronic contact tracing, that this is not as effective, but it is what we're doing here now.
And really, it's better than nothing. If you look at all of the statistics and diagrams out there, a person who is identified early, is quarantined early, whose contacts are quarantined early, really can stop the spread of this. Where on the other side, if we aren't doing this, we can have some serious outbreaks that we don't even know are happening until a couple weeks down the road. So this has become the way in which we can get to where we need to go. They're looking at adding, I think North Dakota is the only state that has enough public health workers to actually do what they think need to be done in doing the contact tracing per capita. And I'm hoping that Montana can get there too. We are going to need to add public health workers to do it in whatever fashion, whether that's direct employment or contract employment. But it, you know, hopefully we get there, and then that will help us get through the phases quicker.
So I'm actually going to go back a little bit, Erin. I don't know if there's anything before we get to phase two that we wanted to wrap up. I think we've covered all the questions. There was a question about how we feel about the 2-week quarantine in light of the lack of testing infrastructure. I think the question being, is 2 weeks enough? One thing that's important to know that if you have symptoms and you've contacted your local health department, you should be taking the advice of the public health nurse at the local health department. So if you actually have symptoms or really even questions, that is a great resource to give you good advice about when you should be returning to having more contact. I know that they have said that you should definitely be 24 hours without any symptoms, without using any medication. So that means if you have a fever, you're not using Tylenol or Advil or something to reduce your fever. If you've been a full 24 hours, but definitely be reaching out to the public health nurses if you're experiencing symptoms. Also your medical provider, that's probably a great first call, is just your healthcare provider, and taking their advice and not just relying on the day count if you've had contact or symptoms.
Right, and there's so much unknown about this virus. It's acting in very weird ways. And also, again, a topic that we could spend an hour on. You know, a lot of people are showing without symptoms. Their symptoms are more inflammatory related than some other symptoms that we are seeing that look flu-like. You know, people, they believe that there's some toe inflammatory syndromes that are related to it, to people who don't have other symptoms but have things going on in their toes. We know that there's some blood clotting related issues that are going on that are leading to strokes and blood clots that are having, you know, that physicians are having a hard time handling. And they're believing all of this is related to this virus. So there are just a lot of different health effects that are being traced potentially back to this, that we know so little, and the public health nurses are the ones that are staying up to date on it as well as they can. So giving advice to you from us would just be complete malpractice, because a lot of physicians don't even know how to really tackle this, or how long somebody is going to be you know, contagious. They have put the 14-week quarantines in place to do the best they could to identify a reasonable time frame. But again, I don't think we know enough to really say, Jackie.
Exactly. So we will go into the phase 2. I think the most important thing to understand is there's not a date at which we're automatically in phase 2, that we are in phase 1 until we're not in phase 1 is basically, and we talked about the different metrics that might be used to gauge when it would be time to go into phase 2, or whether it would be time to go back into the previous. So while number of cases may be a factor, I don't think that it's the sole factor that will be evaluated, and it may be evaluated differently in different counties. So the governor will not be saying, okay, now phase 2 for everyone. The governor could say, we're now eligible to be in phase 2 if your local chooses to move to phase 2.
Yeah, and Jackie, we got a question about the governor's office commenting that there would be a quarantine in effect for all 3 phases of Montana reopening. I think what you're talking about is the quarantine for individuals coming into the state from other places. Of course, the governor's office has control over whether that will stay in effect and for how long. And with the fact that we have so many more people across the country that have this and keep contracting it, and we have, you know, a continued rate of reinfection in other places, then you know, it makes sense that they would do that. But again, we'll know more as the press releases come out from the governor on that detail. There's also another question that I was looking at related to another topic. I think I'm missing it now, Jackie, but I'll jump in when I see it.
Is it the evictions and
yes,
the service? Yeah,
right.
so that is in effect until May 24th. If you look back on the slide that was the timeline, you'll see that the governor provided rental assistance and then did not allow for evictions, discontinuation of utility services, those sorts of things. That's currently in effect until May 24th. So that's currently outside of these phases. It's unknown if the governor will extend that. I think that is what's currently in effect, though, is the May 24th date. And you can look both back on the timeline slide and also on the governor's website for the directives, and you can see where he issued that directive.
Right, and I would just stay up to date at that the governor's office, because they do come out with regular updates related to various topics, and they are the ones that are, or the governor is, and his office is going to be speaking on these topics as they evolve.
I know one thing that's really become a question as we go into the summer is weddings. That seems to be one of these topics, that the phases. And currently, the group size is very limited in phase 1, and the physical distancing is still in effect. And so if you can have a very small wedding where physical distance is maintained, I think that you could do that. I know that people are getting very creative as to how they're choosing to have those types of ceremonies. But at this point, having all your friends and family gather in a traditional way that we think of a wedding would not be in this, but absolutely contact your local or engage in their weekly calls to see how you could get that done. But there may be ways that your local could help you.
Another thing that's going on that we had learned about, Jackie, of course, it makes sense this time of year, is that people are getting together from all over the state to do brandings for cattle, et cetera, which of course does happen this time of year, and not necessarily taking the precautions they otherwise would. And they're coming from all these different counties that still have ongoing cases and outbreaks, and then going back to the counties that they came from. So, you know, they're just, I think that, you know, more education for our clients and keeping safe, and not only in relation to business activities, but in family activities and other sorts of social engagements could be very helpful from the bar at this point.
The other question is really the how do you enforce quarantine? And it is a self-quarantine. You know, we ask people to do it, but there is a mechanism, and under state law, the sheriff can issue a citation. So if a complaint is made to the sheriff's office or to the public health department, the public health department will typically reach out to that person, figure out what's going on, but ultimately a fine could be issued to the person for not properly quarantining after travel. So you know, a lot of this is just generated by complaint, and then I think the sense that I get is they're trying to use fining and corrective action as a last resort, and they're trying to use education as the first resort, but that is how this is being enforced now.
Jackie, and I know we keep getting questions regarding to potential liability of individuals who are not taking precautions and who aren't staying in quarantine when they're told to do so, et cetera. Of course, you know, that would have to be evaluated under the elements of whatever allegation, whether it would be intentional or negligent. But I think it's worthwhile to consider that to the extent you could trace it, if people aren't being responsible, there will be a question as to their culpability. And, you know, as attorneys, that's something we will continue to evaluate and consider. And it's important for people to understand that responsibility is on them. And at this point, you know, we don't have in our state any sort of waiver of liability for anyone at this point, where in some states there are some waivers for liability that have come down from the governor's offices for healthcare providers, et cetera. And so we all just need to be very diligent because we don't have anything like that in place.
Great. Just clicking through these other phase 2, you'll see that it potentially will open a little more, but for the most part, the physical distancing, social distancing, however you describe it, will remain in effect. Definitely limited capacity will remain. So we just want to remind you again, though, this isn't an automatic thing that occurs. We'll be evaluating what's happening in phase 1 to decide where to go after. I definitely think the number of tests positive will play into that. And maybe some experience of other states too. We're not the only state opening up, and we're certainly a smaller population than some of the states opening up, and their experience may tell us more.
And Jackie, I know we have at least one person who wants to have us cover a little bit on the court system and what's going on. I don't know if you want to do that. I know we have some information on our website. It may be something that, Kathleen, you're already looking at. But I know that the local courts and the clerks are really giving good guidance on what's going on and what the judges want. And so that's a good place to go. Jackie, do you have any other insight from what you've been seeing in the court systems and in the guidance that might help out here to talk about things like how are courts going to hold jury trials? And I know we had a question regarding masking of witnesses, et cetera, today, and that there may be some guidance in case law for it, but not a lot.
Sure. So I clicked through to this is our website. If you click here, you can get to our COVID resources. There's a legal professionals tab. If you click on that, you can get information about the Montana courts, as well as Wyoming and North Dakota court system, and what the guidance is. I would say definitely just keep in touch with your local. Limited hours, I know, is a big one. There's also some restrictions on distancing. There was a question about, well, does masks violate constitutional right to confrontation? I will get the citation to the Supreme Court case. This isn't an issue unique to these types of face masks. This has come up in other face coverings, and the Supreme Court tends to say that it doesn't violate right to confrontation, that you can still see the demeanor of the person, right to cross-examine, those sorts of things. So I will today put the case law about that on this legal professionals site, on our website, if you want to come look a little bit more into that. But we do keep this up to date by the day. So if you don't want to go search around to all the different sites, you can just come here and, or definitely take the links and put them on your website. We do try to get information out, but I would say a little bit of this is going to be what your local court is deciding on how to stay safe. We've definitely encouraged the continuation of telework. If you go back, we have all of our previous CLEs available on our website, where we go into more depth about how to do telework and some options to make that work for your office. I think there was a question about platforms. I know that Zoom bombing is a reality, so you do have to be careful about sharing your information about your Zoom too widely. We use GoToMeeting in our office. I know we've had a lot of luck with both Zoom and GoToMeeting. We also use Slack as a tool for in-office messaging and ShareFile for getting information to clients and keeping that information protected. So we've had a lot of luck with all of that to be able to maintain distance in our office and also with our clients, which kind of brings me into the last thing we were going to cover, which is remote notarization. If there's a situation where you especially have a vulnerable client that you really don't want to have leave, but they need to have something notarized, we've given information, and we've also put this into a PDF that's available on the State Bar website, that we do have remote online notarization in Montana. There are different approved technology platforms. What we have found is that even though there is a number of platforms available, that really only these last two are available for attorneys for the really non-mortgage related that are accepting notaries in Montana. There's a wait list and there's also a fee. That being said, our notary has gone through the process at our office. She is one of 16, I believe, notaries that are up and ready to do this. So if you have a situation where you absolutely need to use this service, you can contact our office or go to the Montana Secretary of State website and find any of those notaries that can do this. But just to know that you can't decide to have remote online notarization available and have it ready to go tomorrow. You're probably looking at a multi-week process to get it implemented, which may or may not make sense for your office. But again, our office is providing that service for a fee if you need that done.
And Jackie, this really was, our notary is so good at streamlining processes. And I use this to do an affidavit for a court, and it was an interesting process. You could tell she did a lot of work of uploading, getting the notary space on the document ready, making sure she had the video set up appropriately. And because when you do these notarizations, you have to do it over a live video cast, and then go through the process of doing the electronic signatures. And then she has to keep that video for 10 years. So we have to also, in our office, or did set up a secure private area on the server that we know is backed up so that she can keep those just like the people are keeping the books. And so there are a lot of pieces to think about and to go into it. But when it's done well, it actually works very well and very comfortable. You can sit in your house, your clients can sit in their house, and really be safe and do the process and know that it's done and you've taken care of it and that it was done compliant with all the requirements under the law. And, you know, that gives you a bit of peace of mind. You know, no one's going back potentially exposed. No one has to put on masks, and people can feel comfortable about moving forward with these legal processes. So I think
we've
Jackie,
done a good job. Yeah.
Oh, go ahead. Sorry.
Oh, I was just going to say, I think we've done a good job at, I was on mute, so I was talking there for a second, but at answering the questions as we go along. It's just about 10:30. You'll automatically get the additional 0.5 CLE credit for staying on. If you have anything else, definitely reach out to us by email. I also encourage you to look at our website for information. Take that, post it on your website. Anything that you need, certainly. I know Sam is also available and getting questions to us.
Right.
Is
And
there
the
anything else,
business and
Erin?
yeah, I was just going to say we didn't show everybody the business and employer area. It's for profits, for profit and nonprofit organizations. We tried to keep the information for both up there. In addition, we are updating it daily. So you'll go there today, see one thing, and then tomorrow there's 5 more things that have come out and 5 more things that we put up there. So just know that it's not static. We are trying to keep it updated so that you, our clients, everybody, and we have a place to go to see where everything is. We just want you guys to know we did the best we could today covering a lot of what's coming out, but we definitely didn't get everything, and we know that. So please go to the links that we provided in the program because they have so much information, and maybe some of the questions that you still have in your mind will be answered on those links that we provided and some of the other resources that we pointed you to. Thank you for all you're doing for all your clients and for being here to help us get all this word out to everybody about what's going on. And thanks for the State Bar, Sam. Thanks so much for setting this up for us.